Good afternoon and welcome to our St. Clair County Emergency Management Agency update briefing. We're joined here today with a couple more special guests, but before we get to them, I want to introduce our Executive Director of St. Clair County Health Department, Barb. She's got some updated information for you.
Okay, thank you, Herb. Good afternoon, everyone. Again, we're very saddened to report across the United States we have 400 deaths from COVID-19 out of 33,404 cases that have been tested. In Illinois, we have 3 more deaths, a total of 12 deaths, all up in the Cook County area in the state of Illinois. And the number of cases have gone up by 236 from yesterday, for a total of 1,285 cases in Illinois. Numbers keep going up, and in St. Clair County, we have added an additional positive case to COVID-19 in a female in St. Clair County. So we have a total of 4 cases in St. Clair County. 2 cases were associated with travel, and 2 cases appear to be community related. With this, again, there is some testing that we hope to have very soon. We're waiting for the supplies from the federal government to be able to offer this testing. That's why the Department of Public Health and other agencies are really limiting who can be tested, and only those that are very susceptible and are the ones that we're focusing on testing at this time. Again, you may have heard that Memorial Hospital has a drive-through clinic at Swansea. These two are very limited in who they test. They have specific requirements, and they will only test those that have doctor's orders to go to that facility. So more information will be coming on that, but only those that have doctor's orders can be tested at that facility. People are wanting to be tested, but what I would like to just really emphasize to everyone, just because you haven't been tested or just because you don't have symptoms doesn't mean you can't carry the disease of COVID-19. This is so very important, and we need to treat each other like you're a carrier, like you can give it to the person next to you. Just as we have social distancing in this room, just to make sure I may be feeling fine, but I may be able to pass it on to someone else. So please, we need to reiterate this to everyone. Make sure your children follow this, the persons within your own home, the persons you may work with if you're part of that essential population that needs to go to work. This is very, very, very important. This is a new norm for us being told to stay home and social distancing from each other. And it's tough. It's a tough thing to do, but in the good of public health, we all need to do this. We all need to do this, regardless if you've been tested or not. So again, please promote this to your family, to your children, to your teenagers, to everyone around you, and we will get through this. But only with that we work it together as a community, can we beat this COVID-19. Our numbers may be low at this time, but I suspect they will go up as more testing comes up. But let's make sure we treat each other respectfully, that we all may be carriers. So let's put an end to this transmission. Let's work together and do that. It's real. It's different. It's different for each of us every single day. But we can get through this if we follow the rules. And with that, I would like to turn it over to Chairman Mark Kern. Mr. Kern, our updates for today on this Monday afternoon.
Thank you, Barb. And Barb Holt is the Executive Director of our St. Clair County Health Department, and Barb has been doing a great job during this epidemic. We appreciate you choosing this live feed to get local information and some of your information from. It's important to pick the places that you're going to get information about this virus from. And we believe that this live feed provides a good, accurate level of our response in this area. Also, let's keep our first responders and our medical community in our prayers. They're extremely important to us. They're out there putting their lives on the line. They're facing this highly contagious virus in order to get their job done. and so we need to remember them in our prayers. We started this morning. The courthouse is now closed to the public except for our courts and the circuit clerk's office, which operates through the court system and with the court system. So those services are accessible. Anything else that you may need at the courthouse, call our dispatchers. They are open at the courthouse. The switchboard is open. Call the courthouse switchboard from 6 a.m. to 6 p.m. At 277-6600, and you can ask about any service that you need and whether those are still accessible at the courthouse. Also online, we've listed those services that we offer. This has been a busy day. We started our day with a conference call that was set up by State Representative Jay Hoffman. We talked with all our Illinois state representatives and state senators that represent St. Clair County, and we had a great, frank discussion on personal protective equipment and the need for that in this area, and they all in concert agreed to help us to expedite any shipments of PPEs to St. Clair County for our first responders and for our medical community. In addition, we discussed small business and the incentives and things that are going on to try to keep small businesses alive and in business during this epidemic, so that when all this ends, we go back, we'll have the businesses that we've always grown to love and support still around. And that's extremely important to us and also to our state representatives. This afternoon, I had a lengthy call with United States Senator Tammy Duckworth, who called in St. Clair County to check on exactly what some of the happenings were. She reiterated her support for our county and for our residents and for the state. Her priorities include trying to get resources to workers, to small businesses, and to local government. She's fighting in Washington for those dollars to be able to help us with those needs. Senator Duckworth also committed to help us with the need for personal protective equipment, and she'll be addressing that in Washington to see that Illinois gets its share of those provisions. United Way, I'd like to remind everyone they have a 211 service, and that'll get you connected to local resources, including housing, food, healthcare, and mental health support. And you dial 211, and they'll be able to help you access those services. Also, through the county health plan, Optum Emotional Support Helpline has been open to anyone who lives in St. Clair County. You don't have to be part of the county health care plan. Everyone can access with the telephone number 866-342-6892. It's free of charge to everyone. Mental health issues, the health experts will be there to help you through any problems you may have. During this crisis, we need to continue to call our friends and our neighbors and our relatives to make sure they're okay, not only to help them with any needs they might have, but also just to battle loneliness, which is going to exist during a crisis like this. A lot of people are sheltered. They're at home alone. They don't have anything to do. Television can be boring. Some may not have television. It just breaks up the monotony of the day to hear from someone, whether you are a slight acquaintance or no acquaintance or a family member. Try to reach out to someone and make their day a little brighter than it is today. We're going to get through this, and we're going to get through this together. And when we get past all this, we're going to find that our community will be stronger for what we've gone through. At this time, I'd like to welcome to our live feed the CEO of the Bi-State Development Agency, Talby Roach, along with Chuck Stewart, who's his able assistant, helping with public transportation in the region. It's our bus service. It's our Metrolink service. Talby, welcome. Chuck, welcome. We appreciate you both being here today. So let's start off. Can you maybe tell us what are the procedures that you're using to protect riders as well as your staff from COVID-19?
Sure. And good afternoon, everybody, and thank you for joining us. So trains and buses are disinfected with CDC-approved COVID-19 disinfectants every single night. So this includes a really interesting fog treatment that we have added to for that extra measure of protection that we've done with our partners at CDC and with obviously our employees. Additionally, we are working right now at a slightly reduced rate. And what this allows us to do is midday pull our equipment into the barn so that we can provide additional treatments, giving the public an extra measure of support as far as our rolling stock. But in addition to this, we're taking measures with our employees. Chuck, could you hit on some of those?
Certainly. It's very important that our employees stay healthy in this situation. In order for us to provide this service to the region, we have to have a healthy staff. But we know that there are going to be circumstances where people are exposed to the virus or they get sick. So we've implemented some procedures where we are identifying people that have been exposed. We're requiring people to self-quarantine as a result of that. The important thing is that we have something from a governmental basis that is helping us to make sure that employees are still financially solvent. The President passed the Families First Coronavirus Response Act a few weeks ago, and it was for adoption on April 2nd. We have early adopted that. We have put it into service, and basically it allows employees up to 80 hours of additional sick leave should they encounter the virus or they're exposed to the virus, so that we can assure that from a financial perspective they'll still be in good condition. We've also done what we can to the extent of sheltering in place, the social distancing. We're implemented today at all of our facilities, a temperature checking process. So anybody entering our facilities has to be checked before they come in. I've been checked twice today, as a matter of fact. And we've implemented modified work practices to the extent that employees can. We are allowing them to work at home. So we've got quite a few things in process right now.
So how are your ridership numbers looking?
So certainly there's been a big effect on our ridership. We've probably seen a reduction somewhere around between 40 and 45%. But let me just tell you, Chairman, I took the train in this morning, and on my ride, I would say almost 60% of those folks on that train had medical scrubs on. And what does that tell you? It tells you how important transit is in order to keep our fundamental, essential employees going to work. I've even fielded calls from executives in the grocery industry. Look, we still need to go to the grocery. Those shelves still need to be stocked, and a lot of those individuals get to their places of employment on transit. So we need to still provide that fundamental layer of essential activity, and we plan on doing that.
So Tommy, with all of the changes that are out there, the shelter-in-place rulings, do you ever anticipate having to shut down service?
So what we would have to get an order, of course, from regional leaders or from the federal government if we were to adjust any further in our service profile. Except, of course, in the case where the fundamental health integrity of our operators, and that's why we're taking the extra step with screening, being very, very careful with social distancing and taking every single precaution we can with our workforce so that we don't lose so many workers that we cannot put service out. So those two instances, either an order from our leadership or that we were to lose so many workers that we would be unable to do service. But we're certainly not at that point right now, and we intend on continuing to serve the public.
And what you're doing with the cleaning operations and the screenings, that's all designed to try to make sure that transit continues to operate during this crisis.
It's been very encouraging. Talk about long days. My team was out there at 2 a.m. ramping up for those additional screenings. When I have drivers who are making it, and they're the real heroes here, Chairman, they're the ones who are showing up in this let's say, reasonably rattling situation, but they're still putting their shifts in, and they're showing up as they did this morning at 4:30 to fill their shift in East St. Louis and to go to the facility, get screened, take the extra time. and put our service out on the street.
Talby, Chuck, we sure appreciate you being here. Anything that either of you would like to add?
Chuck, anything to add?
A lot of what we're doing in terms of screening employees and providing for a healthy environment for it goes deeper, goes a lot deeper. We've trained our managers to recognize symptoms. So at any point, if there's anybody that is jeopardizing the availability of employees, we are ready to get them out of the mix and move forward.
Thank you.
Thank you, Chuck, and Mr. Toby. Roach, we appreciate that. And, Chairman Kern, as you can tell, we're doing a little social distancing here, so we're juggling some seats back and forth. Just before we wrap up, I wanted to kind of give you an update on what EMA is going to be doing tomorrow. We've got a conference call scheduled at 10 a.m. with all of our local mayors in the county. We had one this past week. We're going to be doing that pretty frequently to keep all of our community leaders updated on what's going on and if there's any needs that they may have. And then at 11:30 tomorrow afternoon, we have a conference call with the local fire chiefs and police chiefs. The same thing, keeping them updated. We're waiting for, as we said earlier, the delivery of some PPE equipment from the state. They keep telling us it's coming, so I'm hopeful for that. Chairman Kern was able to secure some hand sanitizer for us. We expect delivery on that as late as Thursday. We put out that information to our local first responders today, and already we've got about 29 different agencies and communities that are in need of that. So once we get that in-house, we will be making sure that gets out to the right people. Again, I got an email earlier today from the 911 centers. It seems that some of the people are calling our 911 dispatch centers, asking them questions about the governor's executive orders. And please, as we said all last week, the 911 operators are too busy to field those type of calls, and plus they don't have that information immediately available. So please do not call the 911 centers for that. And just remember, we have other essential people out there that are working. Don't forget our truck drivers who are delivering those goods to the grocery stores, delivering that equipment. You never know what's in those trucks. So please remember them out there also. We'll be back here tomorrow afternoon. We're going to have another special guest with us. And hopefully you heard Barb give us those updates on the numbers. And I agree with her. Those numbers are going to increase without a doubt. But we want to try to minimize them as much as possible. So we'll be back here tomorrow afternoon at approximately 3:30 with our daily update. Thank you for following us.